Morning, everyone. We'll get folks in. Yeah. Good morning, everyone. Thank you for taking some time on this beautiful day. We're here in front of Regions Hospital to make some announcements and to kind of update on where we're at. You're going to hear from Commissioner Malcolm a few of the details. Then you're going to hear from Ken Holman, President and CEO of CentraCare. You'll hear from Andrea Walz, President and CEO of Health Partners. And then you'll hear from Dr. Matthews, who's in charge of hospital medicine here at Regions. And the reason is, as many of you have been following this, Minnesota, the rest of the country, and a large part of the world's in the grip of Omicron surge. And what that's meant is hospital capacity, as we've talked about since March of 2020, was something we needed to protect. As this pandemic has unfolded, it's presented itself in different ways. One of the things we're experiencing right now, of course, is staff shortages in the medical facility. Again, these are folks, these heroes that have been at this for 2 years, basically, in addition to their normal routines that this time of year from flu and other respiratory illnesses fill up our hospitals. That extends itself to schools and to workplaces and other things. We're here today to make some moves that hopefully relieve some of this, the ability to be able to use the authorities that we have both in the governor's office and in the Minnesota Department of Health. What we're going to announce today is we're moving $40 million of that flexible American Rescue Plan dollars that was in the governor's and my authority to be able to move, to be able to hire up to close to 350 healthcare professionals, mostly nurses, to work 60-hour weeks for the next 60 days. And that will be able to use that pool as we've been using the federal government's pool that came in from DOD and others, and the way we've been using National Guard CNAs in long-term care facilities. It will not alleviate the problem, but it should be somewhat of a decompression. But it's at this point in time that I would once again remind Minnesotans the way we keep this hospital functioning and keep the pressure down, the way we keep our children in school, and the way we keep our businesses continuing to function is to continue to lead the nation as we are for the 4th week in a row in booster shots. We just announced a new initiative around 5 to 11-year-olds to get those little ones their shots and boosters up, and also continuing, and I know we're still challenged across the country, but in Minnesota there are still options to make sure you're testing. And then I would just make note of this, especially with Omicron and how quickly it is able to spread. Masking when we're indoor or crowded situations make a difference. And for those again asking, I would use the statistics now that we've got some pretty good details around Omicron. Those that are vaccinated are 17 times less likely to end up in the hospital, and 20 times less likely to die of Omicron. To put that into perspective, it's approximately 20 to 23% more likely that you will get lung cancer if you smoke than don't smoke. It's a pretty strong correlation to here. If you're unvaccinated and get Omicron, your chance of ending up in the hospital is that much greater. So I would ask Minnesotans, it's not too late. I would note that we're going to have a pretty challenging couple of weeks here. That's why we're taking this extraordinary action. But all indications are from Great Britain, from South Africa, and some of the details that are now emerging here in the United States, that once we hit this peak, we should start to come down relatively quickly. That's why the triage situation, that's why we are in a state of emergency in our hospitals, and that's why we're taking this action to make that move. So I want you to hear from Commissioner Malcolm and then hear from some of these hospital experts to tell you exactly what they're doing, what the situation is, and what this move should do to relieve some of that pressure. Commissioner Malcolm? Boy, oh boy, it's nice out.
Oh, lovely day. Well, good morning, everybody. Thanks for joining us here. About a week ago or so, maybe 2 weeks ago, we all opened up our newspapers and saw a really stunning statement from the CEOs of some of our largest healthcare systems around the state. They together made a really strong plea to Minnesotans that we are in really an unprecedented situation in terms of our hospital capacity. And they asked us all to do what we can to help take the pressure off of these hospitals for the sake of all of us, for the sake of not only the people with COVID, but every single health condition that requires hospital care is being impacted by this shortage. So the extraordinary nature both of the hospital capacity and this Omicron surge that is affecting literally, the entire country at the same time makes this different than prior surges, and it's going to feel different. The fact that this is happening everywhere sort of simultaneously just puts further pressure on capacity. It makes it more difficult to get federal help. We've been very fortunate to get federal assets here in Minnesota, but those federal teams that have been here are in demand everywhere simultaneously. So that's why we're taking the extraordinary step today that the governor just mentioned with his $40 million request for his flexible funds. And he explained that is going to help us bring in a significant number of staff from a very large staffing agency who's had really good reviews, if you will, from other states who have used them in a similar way. So we're going to be getting, don't know the precise numbers yet. We're working on that contract as we speak. But we anticipate having a very solid core of nurses and other supporting healthcare service folks, respiratory therapists, some physicians, to help augment our hospital capacity. We can get into some of the details about that later. In addition to the financial support to bring in temporary staffing, I am also taking an unusual step today. In that I am using some authority granted to the Health Commissioner under Chapter 12A.08 that allows the Commissioner to do certain things under an emergency such as this. So today I am waiving licensing fees and some of the restrictions that make it difficult for hospitals or nursing homes to add beds or flex type of beds. So waiving both the licensing fees on those beds and giving more flexibility for bringing beds online. Also allowing nursing homes to quickly expand capacity by reactivating beds that they had previously filed with us to leave those beds vacant. So again, with more staffing coming in, we also want to make it possible for physical capacity to be opened up where that makes sense. I'm also taking action to permit nursing homes to more easily move or transfer patients without the normal waiting periods that apply to discharges and transfers. As we've talked about before, our healthcare workers in acute care, long-term care, and also public health have worked absolutely tirelessly for the last 2 years. They have been there for us every day, and it's time for us to be there for them. As the governor has said, and as these leaders have said, it does matter when people take advantage of the tools we have now to manage COVID and the surges and the variants that will continue to evolve most likely. Vaccination makes an enormous difference, as you heard the governor just say. Testing when people are feeling any symptoms at all is important. Staying home when you have symptoms and wearing masks indoors and in close quarters, even outside. The recommendation is very much focused on indoor masking, but that extra precaution when you're close to people just makes sense. So these are all things that we can do that really do help the hospital situation. So don't do it because a government official is asking you to do it, whether that's me or the governor. Do it because it's good for you, good for your family, good for your community. Do it to help these healthcare workers. We are going to be in some really, really constrained circumstances in these next few weeks. As the governor said, we are hopeful that it's a rapid rise and a rapid decline in terms of number of cases. But these next few weeks are going to be something that we've not seen before in Minnesota, ever, in most of our entire careers. This degree of capacity challenge in our healthcare system. So please, everybody, do what you can. We all can make such a big difference by doing those things. Vaccinating, testing, masking, being just mindful of the ways that we are interacting with each other. And with that, we're going to be happy to take your questions later, but I'd like to call on the CEO of Health Partners, of which Regions Hospital behind us is a significant part. And again, just expressing my personal gratitude to our health system leaders for the collaboration that they have shown amongst each other and with us at the state. So with that, Andrea Walsh.
Thank you, Commissioner. On behalf of the Health Partners team, the doctors, nurses, and care systems and care teams working here at Regions Hospital and across our organization, I wanted today sincerely thank the Governor and Commissioner Malcolm for this very welcome show of support for Minnesota hospitals and clinics. We welcome the announcement as an important step in helping us meet the immediate and critical healthcare staffing needs that we see across the state. The need is really clear. Our care teams are committed and as dedicated as we've ever been since the start of the pandemic. But we are all human. Our team is stretched. Our care teams have taken extra shifts. They're working longer hours, going above and beyond month after month, and it isn't sustainable. We need additional staff. For instance, today at Regions alone, we have 90 RN openings. So this commitment of staffing agency support will make a material difference and help all of us across the state make sure that we've got nursing and other important healthcare staff available to tend to the needs of Minnesotans, patients who end up ill in our hospital. And the contagiousness of the Omicron variant is impacting our care teams in a really material way. The community spread is real. We're able to protect team members and our patients and keep them safe in our facilities, but out and about, the case is different, to the Governor's point. In fact, today at Health Partners alone, we have over 1,000 people out sick with COVID. That's of our 26,000 people. And patients need us at the bedside, so we're having to scramble and figure things out. Across the state, hospitals are short-staffed. Our clinicians and care roles are concerningly short-staffed across the board. So like early in the pandemic, hospitals across the state, all of us, have had to delay and defer care. We've had to cancel surgeries and needed treatment. That too is not sustainable and is concerning to all of us. The pandemic continues to test our resolves. And the message I have for you today from the Health Partners team here at Regions Hospital is you can count on our team to bring our level best every single day and to never give up. And at the same time, we need each and every person in this state to do what you can to help. Please get vaccinated, get boosted, take the precautions we know make a difference, mask indoors. Once again, I would close by saying how grateful I am for the partnership and commitment that we see in our work with the state and across all of the healthcare systems in the state. Thank you to the Governor and the Commissioner for the step they're announcing today, an important step forward. We look forward to the further partnership, and I'm also very grateful for the strong and enduring partnerships we see across all of the healthcare systems to try to ensure that together we're able to meet the needs of the state and the people who live in this state. It's my pleasure to introduce a dear friend and colleague, Dr. Ken Holman, the CEO at CentraCare. Ken?
The challenge is this: how do we provide optimal health care to our citizens in a pandemic that is the worst that hits this planet in over a century? Thank you, Governor. Thank you, Commissioner. What was just announced is a much-needed troop of folks who will come in and help take care of Minnesotans who are affected with COVID. It provides much-needed resources, help, and an emotional lift to our staff who are significantly burdened. Just to put some fine points on it from a CentraCare perspective, we have had 20,000 open shifts in the last year where our nurses and physicians have leapt to the forefront to help care for our patients. Like Andrea, we have over 800 folks out sick with the coronavirus. So how do we mitigate the spread of the coronavirus? We have 175 locums who are helping us out. With the Governor's help, we also were able to get an Air Force medical crew in. They've been there for 2 months. We have National Guard folks helping us out. Thank you. In other words, this has been a significant collaboration to allow all of our teams to operate at their best every day to take care of our citizens. And as Andrea so aptly mentioned, we have been forced to have delays in other needed healthcare issues. I'd like to mention some of the false memes that are out there. One is, of course, that our vaccination requirements are the root cause of our problems. They are not. CenturyCare has over 12,000 employees. We lost 120 employees to the vaccination requirement. Every one is a loss. But 120 folks, 40 of them have come back. 29 of them were direct caregivers, the rest were in support roles. In other words, there is a remarkable consensus amongst healthcare providers in our state that this is the right thing to do. Another meme, of course, is that we really aren't that busy. So I compared some data. January 7th of 2020, pre-COVID. The St. Cloud Hospital ICU is a regional ICU. At that date, we had 21 patients. This past Friday, we had 49. 2 years ago, there were no COVID patients in our ICU. This past Friday, 90% of our patients were COVID, and 80% of them were on ventilators. And a few Sundays ago, we had 10 patients die on a weekend from COVID. It is real. So how do we as a citizenry understand what Andrea and the governor and the commissioner said? That's this circle of trust. We have developed trust amongst healthcare leaders in our state, along with our government officials. That is beneficial to our population. So the question for all of us is, how do we support that circle of trust to keep us over the next few months as Omicron continues to rip through our society? Please wear a mask. It decreases transmission of the coronavirus, and please get vaccinated a booster. It prevents serious illness, hospitalizations, and death. With that, I turn it over to Dr. Matthews, Chief of Hospital Medicine at Regions.
Thank you, Dr. Holman. Appreciate it. I'm Dr. Benjamin Matthews. I serve as Head of Hospital Medicine at Regions Hospital here right behind us and oversee operations in COVID for our hospital medicine patients. And also work clinically. I've seen a lot of COVID patients this last week. On behalf of the doctors, nursing staff, and our organization, but also throughout the state of Minnesota, I want to thank Governor Walz and Commissioner Malcolm for their show of support. As you've heard, we've pulled almost every single lever so far to help with our staffing. This means we have physicians and nursing staff who've not usually worked in the hospital coming to work in the hospital. We have residents and learners who are helping support us, who have pulled out of their outpatient clinics and rotations to help us. So it's been all hands on deck. But this pandemic feels rather different to me. I think our state has a new record high 7-day total census. That's pretty impressive, right? Virologist Bedford, I think, had 1% of Americans being infected each day, happening right now. And 5 to 10% of the U.S. are currently actively infected. Those are mind-boggling numbers, right? Our ERs are filling up. Today we have a lot of people that are waiting, the delays. There are a lot of non-ICU patients as well. You know, on our first wave, we had patients that were stopped coming to the hospitals, right? In the subsequent waves, we had more and more patients coming in. This wave is different. And I thought of two things that I thought were different, right? You've heard some of this. We're seeing everyone and then COVID on top of that. And many are with COVID, are coming for COVID, but some are coming with COVID, meaning COVID's a bystander. But I think all of it's COVID, really, because these patients that have bystander COVID, for example, they're maybe incidental for a little bit, but we have to put more resources onto those patients, check more labs, and some of these COVID incidentals become truly catastrophic COVID in the hospital, and patients we've seen die and pass away. Not only that, more cases. Second thing is the more important thing, I think, right now, and the reason we're here today. We have no staff. This burden of COVID is additive, and I think it's caused a thinning of the ranks we've had. Just this morning, speaking of the many people that are out in health partners, I received text messages from our colleagues saying they can't come into their shift today. And my response to that is I want to take care of them, make sure they're better, but also I need to think of backup staffing for our system. Can I personally help? Can others help? And when I call our backup, what happens is they're either tapped out or they are positive, right? And our reserves are really spent. So our key message here is that healthcare systems and our colleagues have taken a hit. Hundreds and thousands of doctors across the state are all with COVID. Our stress is high. And I think one of the things that I want the community to hear is that our doctors are human, right? We're going through this, and our empathy is taking a hard hit. We will fight and take care of every patient that comes through our walls, regardless of their background. But our empathy has taken a hit. As someone has said before, imagine a 50-car pileup on the interstate, and the roads are really icy, and car number 51 is coming in, right? And that car that's coming in, they've been warned, the roads are icy, it's slippery. But why are they going into that? Have we taken the necessary precautions, right? And I think, I wonder if the public can hopefully see the problems and hear that through our voices here. Some may not realize the reality that until they've fallen off the cliff, or they've called 911, or their loved one comes in, or they come into the hospital, and there's significant delays. So our heart is that you know that we can count on the doctors and the nursing staff that are coming in. We're gonna be there for you, regardless of your background, regardless of the conditions that you have. Yet, as the team has said here before, we need your help. Get vaccinated, get boosted, have your masks on to limit the spread. So thank you to Governor and the Commissioner for the announcement today, and I just hope this is the best step forward as we continue to work together as a community. Thank you.
Thank you, Dr. Matthews. Thank you, Dr. Matthews, President Walsh, Dr. Holman. You're hearing it from these folks. They're the ones dealing with it every day. The Commissioner and I were just talking. It was January 21st of 2020 when the CDC confirmed the first case of COVID. So this next week, we'll be moving into year 3. I think, as we were saying, we all hoped that it would be short. It would be more like the flu. We didn't know early on. But what we did know was, and I'm really proud of this team and the cooperation and that circle of trust that's been built, and Minnesotans getting in this, hope is not a plan. A plan takes resources. It took a lot of planning to get out tens of millions of tests, millions and millions of vaccines, hundreds of millions of masks, and all of the information that goes out there, plus the stress. Again, thinking about this, 24 months is what we're coming on where these folks started to see this increased stress. You heard Dr. Holman talk about the 20,000 shifts. So we've continued to evolve the ways that we approach this. We have the tools to mitigate this in vaccinations, in masking, in testing and isolation. We have the ability to help them out. This is going to be another move in the triage situation to put more folks on the ground. This will be, as you heard, the Commissioner using some of her authority to do a few things that would help. All of these things will triage and make a short-term difference, but Minnesotans can make a difference in this by following a few of those guidelines. Again, the modeling is somewhat uncertain with Omicron. We're learning more and more every day. It seems, as I said again, that there should be several weeks of this and then a drop-off. What we've seen, though, and these health professionals know better than I do, hospitalizations follow case counts, death follows hospitalizations. That takes another month or so. So we got some work to do. We'll do it. These are the right folks to get in there. We will do our work to make sure they're there and used correctly across the state. And I would end, before we do questions, to note this coordinating amongst the hospital systems, both large and small, is critical. I heard from a Western Minnesota hospital today. They were looking for more testing. They got in touch with the groups of the C4, of the Coordinated Care Campaign. They put them to call the right person. And as I'm standing here, I get a text that says they're getting more tests on the way. Those are the way it works in Minnesota. It's made a difference. It's saved lives. With that, I'll take questions. Tom.
Senator Miller is calling, hoping you will call an immediate special session to do 2 other things. Maybe he sent you a letter on this. Passing the multi-state nurse licensure compact to allow licensing for out-of-state nurses, and streamlining of select regulatory requirements to those pending hires in medical facilities.
Well, the first week of October, I sent the Senate, the Republican Senate, a letter of things that we had. There were 14 things in addition to those that were on there. I guess better late than never they're responding. I haven't got a chance to see it. I've been up here. It's probably an encouraging sign, at least a recognition that there's things that we need to do. But this will take a negotiation between the House and the Senate, if they're able to do that, and if it makes a difference for what we're trying to do. The problem we have is that if you go back and read the October 4th letter, I said we need to prepare ahead of time for what's coming. There's a real possibility that we will see a surge, and that was a Delta surge at the time in December. And in that letter I mentioned if we see another variant. So I'm encouraged by that there's negotiations. We've continued to ask. I've continued to ask them to get together. I'll go take a look at it and see if these things make a difference.
Governor Walz, one of the resounding themes of this pandemic is that there are not enough people to staff hospitals adequately. How confident are with 300 some nurses?
Yeah, I might let these folks. It's a great question, and I'm standing over here asking these folks as we're doing it, as we protect, because I don't know who wants to speak on this, or all of you. I want you to hear it from them, because these are suggestions coming from the experts.
So what I would say is there is no single solution. 300 nurses is really, really helpful for us, and I think it comes on top of resources that Dr. Holman mentioned, the Department of Defense teams in, the National Guard teams in, the support and focus on nursing homes and transitional care units. So I would say from our vantage point, 300 nurses that we can get on board in our hospitals within the next couple of days, the next week or so, will make a material difference. Will it solve the whole problem? It won't. The only thing that will solve the whole problem is us collectively taking the steps we need to take to protect and safeguard our community.
But I think what she was asking is, can you find these?
Yeah, where are these nurses going to come from? And where are they going to go to? How are they going to be spread out around the state?
So I will back up a minute and say that this is a classic, I hate to use a term, because these are people's lives and our workers, it is a supply-demand mismatch. Pre-COVID, we knew a lot about healthcare, the demand for care for cancer, the demand of care for heart disease, the number of accidents per year. And so our healthcare system in America and our state was built on decades of knowledge related to staff that we had available. The pandemic hits and all of a sudden demand becomes unmanageable, right? And so now we have this demand of COVID, and we're trying to take care of the demand of normative health issues. People are still having babies, heart attacks, car accidents, etc. So we have been relying on our staff to fill in the extra void. There are only X number of nurses in America. Make sense? You can't manufacture them. And when the pandemic is around the world and around the country, we can't borrow from somebody else without somebody else being impacted. Parallel to that, we have the Great Resignation going on in every industry segment in America. There is not a quick solution. There is not a silver lining in this thing. This is where we all have to grind it out together by, number one, decreasing the demand of COVID on our health systems and our population. Number two, reinforcing our healthcare workers who are giving so much, and finding additional new innovative ways to provide care to these patients, and simultaneously try not to delay care for those that really need it. There is not a simple answer on this. This is really complicated, and it requires everyone to be at their best.
Thank you. Let me address that question about how confident are we that we're going to get these nurses. We are, as we speak, negotiating a contract with a large national staffing firm. We've learned about them from the experience of other states who've been really positive in terms of the work that they've done. So I think you ask a good question in that the situation is very, very fluid. There's demand pressure all over the country, but we are, as I say, in negotiating this contract right now. This firm has a good track record of delivery. So this, we feel like, is the best thing we can do. We've been using staffing firms all along. The individual systems use them. We've used them for emergency staffing. But this particular large company is not one we've worked with before, but has very good reputation.
Where are these nurses going to go? Are they going to be spread out equally around the state?
Yeah, thank you. Let me address that. So we are working with our regional healthcare coalitions. There are 8 of them around the state, and we think that they will be helpful in playing a role in helping to figure out where within the regions this will be helpful. And for the large systems, the tertiary care providers who are getting a lot of these referrals, as they get more of this staff, it will help them be able to take more referrals. So no, they're not going to be staff going to every single hospital in the state. This will be more strategic, placed where it can do the most good. It will mean that patients, as they are now, are needing to move around the state to be placed in where they can get the care. So We will take the most strategic approach that we can to this in consultation with the health systems and with those regional coalitions.
Regulatory hurdles. I know part of Senator Miller's letter about the discussion was allowing out-of-state contacts for nurses that are licensed elsewhere to work here. Is it a national firm a problem with that?
Actually, in this case, that was one of the first questions we asked. This firm has a large number of nurses under contract who already have Minnesota licenses. We have stipulated to them that it's not okay to just take a nurse from Regions that also has a contract with the staffing firm and call that an ad. That is not an ad. So we're looking for 300 nurses with Minnesota licenses who can supplement the nurses that are already on duty.
Commissioner, there have been reports in California the problem is so bad, the shortage so critical, they're allowing some healthcare workers to come back who have tested positive but are asymptomatic to come back before the end of an isolation period and before having a negative test. I mean, that's how desperate they've gotten. Is that happening here, or would that be allowed to happen here?
Well, the CDC guidance for healthcare workers does acknowledge that in severe staffing crises, it may be necessary to further shorten isolation and quarantine periods and to be very judicious in what could an asymptomatic positive worker do that would be safe. So it's not out of the question that would happen here. We do have that healthcare worker guidance. The health systems are very familiar with it and working with it as we speak. But it's not a blanket thing.
Is it happening in the health systems? Have you been able to allow people to come back who are asymptomatic?
Yeah, that happens in, so the question is bringing back people who are COVID positive with asymptomatic relatively, and can they take care of patients? We haven't done that in Health Partners yet, but it's on our trigger card of things that we could possibly operationalize. But when they take care of, in the California sector, they're coming back to take care of COVID positive patients only. So they're in that cohort and isolation, et cetera. So we haven't done that yet, but it's on the cards of things that we could operationalize down the line.
So if they would come back, it would only be to work with people who
Correct.
also already...
Correct. You don't want to transmit it further, so you'd be in an isolated ward, cohorted, and precaution isolation guidelines follow. So you don't want to transmit that to other patients either. So, yeah.
One thing you did address, you said you're seeing patients clinically. Are you seeing anything different in the clinical pattern in the COVID patients you're treating with?
Good question. The patients are generally a little bit younger. There's a cohort that are also vaccinated that have breakthrough cases. That's a little bit more than the prior waves. But by and large, we're seeing the unvaccinated that are still getting into the ICU. So by and large, younger population, a little bit more, a little longer medical surge patients, so not ICU level patients. A lot more of that cases are coming in. So that's what is keeping the patients in the hospital longer, higher oxygen needs. And so they're either kind of toggling between getting into the ICU and getting worse and not able to go home or discharge, and they're taking up the beds in the hospital.
And then with respect to these incidental patients, there's some talk you might see more of those in Omicron because so many people have Omicron.
Right.
Are you seeing an increase in those kind of patients even if they do develop into severe COVID?
Correct. So we talked about many patients coming in for COVID and patients that are coming with COVID. Those incidental cases, we have patients with heart failure, kidney infection, pregnant patients coming in with COVID. And some of those, I think the data nationally has been shown about 25 to 30% of the patients are having with COVID. And those patients, there's a subset, I don't know the data yet, would get pretty severe. So you have to watch them and hawk them pretty closely. So that's the challenge behind it. COVID can manifest in multiple things, with skin to gut issues to heart issues to the classic lung issues. So it's being really prevalent and ready for any of these things on your differential diagnosis and clinical reasoning. That's what makes it challenging. Thanks.
With regard to the vaccine mandate, can you say more about that, about the employees that you've lost, and you still feel good about that decision?
In complex situations, it's really important to pay attention to a first-order question. The first-order question for all of us must be, how do we manage this pandemic? Over the past months, amongst our healthcare leaders, and indeed leaders around the country, we've had a conversation about how we accomplish several levels of objectives that support that primary goal. How do we keep our staff safe? How do we keep our patients safe? And how do we keep our public safe? A vaccination requirement, and remember that healthcare systems across America have a number of requirements We have requirements for other vaccines, smallpox, tetanus. We have requirements for licensure and education to make sure that our public gets high-level care. So our vaccination requirement, just like the other systems in Minnesota, was a very thoughtful, deliberative one that we developed over months of planning to see what was going on. The coronavirus is new. We don't have all the answers on day one. So it was a process of working together to figure it out. Over a 4-month period, we worked with our employees to have them understand the importance of the requirement, educate them, answer questions. All of our physicians and APPs are compliant. We set up one-on-one listening sessions. At the end of the day, 122 people left our organization because of that vaccination requirement. 29 nurses. Since then, a number of them are starting to come back as they see the effects of Omicron. So the vaccination requirement was an important part of how we achieve our primary objective: protecting our staff, protecting our patients, protecting our communities. I'd also maybe say a word a little bit about greater Minnesota hospitals, smaller rural hospitals. As you know, the news cycle tends to be pretty metropolitan heavy. That's where most of the people live. On the other hand, the lives of rural Minnesotans are really important to us. And I must compliment and shout out all the rural hospitals that our systems work with. Remember, we work with these rural hospitals, and they feel the same pressures that we do. There are patients on ventilators in the emergency room in small hospitals across the state of Minnesota. They have the same staffing issues we have. All of our systems have made available content experts. So we every day have an infectious disease, a critical care doctor, and a hospitalist that's available on a special phone. So if someone calls from northern Minnesota or greater Minnesota about a healthcare question for a patient that they are keeping, because we are full, because Health Partners is full, we work with them actively, and they are feeling that same stress. Many of these smaller hospitals do not have robust ICU capacity. 2 weeks ago, I had a call from 2 CEOs in outstate Minnesota. They were looking for a ventilator. And so when we talk about the impact of the pandemic, it is important to recognize impacts all of us. Rural Minnesota, greater Minnesota hospitals and systems have been marvelous contributors and are indeed part of that circle of trust that the Commissioner, the Governor, Andrea, and I, and Dr. Matthews have talked about and have been participating in for over 2 years.
Andrea, I wonder if you could give an update on how many employees you have lost to the vaccine mandate. I haven't seen those numbers.
Sure, yeah. So we have about 26,000 employees that work across our Health Partners organization. We had, and I'm doing this top of mind, I know we ended up having about 66 team members who were deemed to have resigned because they did not comply with the requirement. I think initially our deadline was November 1st, and my recall is we had, let's say, 120-ish that still were not quite fully vaccinated, or were partially vaccinated, or not vaccinated at all. So like Dr. Holman mentioned, we had several team members who I think were waiting to see what the consequence of not getting vaccinated meant, and as the deadline approached, decided to make the call and take the shot. So
How many more did you mention there? You know, of the 66?
you know what, I can go back and take a look at the top of my mind. I can't tell you, but 66 would be out of the 26,000. Yeah, so the approach that we took at Health Partners around our vaccine requirement was to focus first and foremost on education, to help people understand why getting a vaccine is important. We really held off on the consequence of not getting the vaccine until right at the tail end of our deadline, which was November 1st. In early October, we signaled to people, our team members, that if they didn't have COVID vaccination completed by November 1st, that they would be put on an involuntary leave for 30 days to get the job done. And so that 120-ish are the number of people who were put on leave, and the 66 are those who by the end of that leave period still had not begun to get vaccinated. Mm-hmm.
Yeah.
continue.
Facing the staffing crunch, should school guidance be updated just for teachers who are exposed or teachers who get COVID for virtual quarantine time?
I'll have Commissioner Malcolm deal with this, because we do talk about, and we get on our briefings every day, talk about the different sectors, and I think this staffing shortage that you've heard, I think the one thing I would say is, again, and we've all known each other here for 3 years, back to this issue on the non-vaccinated workers, I'm just going to call of getting lost for the the forest for the tree issue here. They both told you they had over 99% of their people vaccinated, and the vast majority came back, very few in direct care. We're talking about adding more nurses to the pool on this, and I'm still fascinated in this country where that is the area of focus, because we know what stops this. And getting this information out to people, and the same thing with schools. I'm deeply concerned about schools over the next 2 weeks. I'm deeply concerned because of staff outage on this. I'm deeply concerned, again, because Commissioner Malcolm and I, the good news is it looks like at this time Omicron is less likely to cause the deep lung issues and the long COVID, but I don't know that for a fact. If you go back and look, in March of 2020, one of the things Commissioner Malcolm was very clear about is understanding what long COVID does. So getting this guidance to individual sectors is where we're at right now. So.
Do you think, though, that teacher quarantines should be eliminated for exposure at home if they
No,
have
I'll let Jan. And again, it's not for me just to decide. I follow CDC guidance.
Yeah, I think hopefully it's been clarified that when the CDC came out with its general public guidance, it was just last week that they said, yes, this applies to K-12 schools. So that shortened quarantine guidance for teachers, staff, kids does apply. So they still say, you know, if it's different if you're asymptomatic versus symptomatic, but that shortened guidance is in place for schools. CDC has said they will be issuing sector-specific guidance for childcare. They haven't told us when, but they said they are working on childcare guidance. I think they appreciate, as do we, that childcare plays a really critical role in supporting the ability of workers to work, including in healthcare. So I'm expecting that there will be shortened quarantine guidance for childcare as well. We've said in the meantime, you know, you can use the CDC guidance for K-12 until we get sector-specific guidance. What I think has happened, though, is that we've been much more clear. DHS has been clear from a licensing perspective. That is not something that they're going to have as a licensing requirement. These things are still health best practices. There's still recommendations that for optimum safety, we would want to stick with those longer quarantine periods. But we understand the operational reality that, especially as we get more clear and more confident that infectious periods are shorter, that it does make sense to shorten those quarantine guidances. So more to come on specifics around childcare, but for now, I think we are saying that those shortened periods are applicable in childcare.
That's our time today. Any final thoughts, Governor?
Yeah, once again, thank you all for being here. I'm going to make sure I thank our hospitals, and they're representative of the entire group of folks across the state. It's pretty incredible what they've been able to do. We've worked incredibly closely, developed strong relationships to get these things done. One of the things we promised in March of 2020 is protecting the life of Minnesotans, and we did not know much about COVID at all. We were washing grocery bags and those types of things because we didn't know how it was spreading. We've learned much. We've learned much through the time, but the one thing that I can tell you is this continuing to upgrade, continuing to see when things make a difference, have made a difference. And today's announcement of getting these nurses out there, we'll of course follow up with you when these folks land, get some information on where they're at. Hopefully, as you saw and followed with the DOD and the Air Force teams. And I just want to note, because of this circle of trust, as Dr. Holman calls it, or this partnership, we've been one step ahead of a lot of states. I got numerous calls from governors, first asking how we got those teams from DOD, and then asking, why are you keeping them longer, because we need them now, type of thing. The same thing is true of what we're doing with this. I would guess there will be other states try and model this. There's been a couple that have done this recently, but a lot of these moves are things that the systems themselves and the experts have thought about what was needed. We were able to implement them, and they're making a difference. And that quick moving, whether it was the start on testing or whether it was the ability to get vaccines out fast or focusing on boosters. I'm really proud of the fact, because I think a day is coming when to be considered vaccinated, fully vaccinated, it'll probably include the booster. If that's the case, there's no state in the nation that is more fully vaccinated than Minnesota, because we're leading in the boosters. And I think that in itself should start to show, and it is showing, reduction in the serious illnesses. So we'll follow up more. We appreciate you all being here, and I want to thank the folks who are here. I never got briefed yet. I've been on the call for COVID all morning, so I'll have to follow up with you. No one's briefed me on this. We've been COVID the whole way.
That was a non-COVID question?
Yeah, Chris, you know?
I'll let Claire call it.
Yeah, I didn't hear on it yet. Thanks, everybody.
Well, maybe that was unanimous.
I'm going to use that answer. I haven't been briefed on that yet. I'm going to use that answer for any random question I can think of.